there are 100 cases in all over the world, 26 cases are from India. So such a high burden country we are having. And if you'll ask me, Mumbai and Peri-Mumbai area, that is Mumbai and Thane Municipal Corporation, have the maximum highest number of tuberculosis patients. In 2019, we almost had 79,144 deaths due to tuberculosis. All over the world, it is the around 1.8 millions of people have died because of tuberculosis.
अगर कोई आदमी अपने लाइफ में इस बात को उतार ले, उसका पालन करने लगे कि वो रोज सुबह उठे 4 बजे, 4:30 बजे, 5 बजे भोर में, और उसके बाद वो 10, 15, 20 मिनट, आधा घंटा टहल के वो योगा कर ले, अच्छा योगा का एक पैकेज अगर वो कर ले, वो कभी जिंदगी में बीमार नहीं हो सकता. यही प्रिवेंशन है.
Next, we will go on to the bronchial mudra, which is direct relations with your bronchial system, your respiratory system. Here is your hand. The middle finger is pressed.
A very warm welcome to Panacea. Today we have sessions on Yoga, Neurology and TB Awareness Initiative. And as I welcome Ms. Shohini Roy Choudhury yet again to our session, I welcome you, ma'am. I'm sure this session again will be very, very educating, and the mass will definitely be following the kind of yoga sessions you have been taking since the past 6 months along with us. I welcome you, ma'am, to the session today.
Namaste and good morning, all of you. Thank you, Pooja, for starting this session so beautifully. And thank you, Beatrice, Apollo Health, Narayan Health, and Beatrice for bringing such good health and welfare to the nation. As you know, yesterday was World Day or Earth Day, as you may call it, and your lungs are the trees within your body. They need to be nurtured just like the trees outside. And when you plant a tree, you create automatic natural oxygen cylinders that is needed for you to live and breathe. So let's all start trying to keep our nature, our earth, our only home as green as possible. Let us plant trees wherever we can and make sure no trees are cut down. As you know, the tuberculosis victims and the COVID victims have gone up at an alarming rate, and the nation is under a red alert. So I'm going to focus today on yoga, pranayams and mudras that will fortify your lungs, which is an automatic spa, taking in oxygen, giving out carbon dioxide, building on the strength of your lungs, your respiratory organs, so that your resistance increases to keep at bay such diseases. And if you've already been afflicted, then it helps you create more resistance and grow stronger. The essential parts of keeping your lungs in shape, in order and strong are your pranayams that our age-old, century-old yoga tells us to do. The pranayams or the breathing exercises are for everybody. The more athletic, the younger can sit on the floor mat and do it in Padmasana. The older, even your grandparents, could do it sitting on a chair or the sofa or a firm bed. So I would ask all of you to try and practice this with the elderly people at home, because they need their lungs to be more fortified, and it also builds up the strength of the family, the strength of the community that India is all about. So let us start with our breathing exercises today, our pranayams, and I would request you all to get your elderly people, to get the senior people in your house, your grandparents, to do it with you. It will enhance bonding and it will really help getting their lungs in order. I will do it in the lotus, in the Padmasana, and if you could do it, that's great. Otherwise, just cross your legs and sit in Sukhasana. Or you could sit, as I said, you could be sitting on an elevated platform, on a bed or a divan or a sofa, a harder sofa or a chair. Padmasana, the lotus posture, keeps your spine health in order, keeps your lower back and the uterus, the ovaries are taken care of with women. For men, it helps with the hernia problem and the prostate. So Padmasana is very well recommended. If you could do it for about 2 minutes every day, sitting on the floor in the lotus, that looks after your spine health and your lower back and your entire system. So we put the right leg over the left leg like this, then the left feet over the right thigh, and this is my Padmasana, if you can see. Hands, the index finger pressing upon the thumb to activate the oxygen within the channels within the body, and on my knees inverted like this, I will do the first breathing exercise, which is the bellow breath. The breathe in and breathe out with a sound. Breathe in as if you are smelling a flower, and breathe out as if you want to blow a leaf. So the tempo of your breath is right. We breathe in through our nostrils, not through our mouth shut, just the nose. But when you breathe in, breathe out with a force. Breathe in as if you're smelling the fragrance of a flower, and breathe out as if you're trying to blow away a leaf which is in front of you. We will do it 50 times, but you could do it 100 to 200 times yourselves, which really fortifies the lungs, the respiratory system, and the cardiac system of your body. It also helps fight hypertension, nervous breakdowns, anxiety, panic attacks, and depression, and brings in positivity into your life. As you breathe in, you take in the oxygen, which detoxes your body, and breathing out, the toxins come out in the form of carbon dioxide. So it's a natural, cheap, and healthy spa for your body to rejuvenate your system. We start, remember, you smell a flower, deep breath, and breathe out as if you're trying to blow a leaf. When you breathe in, your stomach muscles expand. When you breathe out, your stomach muscles contract. Breathing right is very important also. When you breathe in, let your muscles go, puff out your stomach. When you breathe out, pull in, contract your abdominal muscles. So during pranayama, your abdominal muscles also play a role, and it helps you reduce your girth, reduce your weight, reduce the weight and the size of your waist with pranayama. So we start, breathe in, smelling a flower. You can keep your eyes closed if you want, and breathe out with more force, pulling in your stomach. Breathe in, breathe out, 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 breathe in, breathe out. 7, 9, 10. The second cycle of 10, breathe in, puff out your stomach, breathe out. Eight, 9. As I said, if you joined late, as you breathe in, lose your stomach muscles, puff out your stomach. As you breathe out, pull in your stomach muscles. When you breathe in, imagine you have a flower in front of you. you're inhaling the fragrance of the flower. And when you breathe out, imagine there's a leaf in front of you and you're blowing out the leaf. So, breathe in, breathe in, breathe in. Two more rounds of 10. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. The fourth cycle, when you breathe in, use your stomach muscles, puff out your stomach, take a deep breath. And when you breathe out, contract your stomach, pull in your navel towards your spine. Breathe out with force. Breathe in, inhale deeply. Breathe out with force. Inhale, smelling the fragrance of a flower, and exhale as if you're blowing out a leaf. Eight. The last 10. Breathe in deep. Breathe out. Breathe in deep. Breathe out. Hear the sound. Breathe in deep. Breathe out. Breathe in deep. Breathe out. Breathe in deep. Breathe out. 4, 5, 6, 7, 8, 9, and 10. I hope all of you out there feeling more energized with all that oxygen which has gone into your body, with your built-in system, the tree within your body, that is the lungs inside, rejuvenated. All of you with your mothers, your younger sisters, your grandmothers, your grandfathers, who do this together to revive your body and create an automatic system of finger and little finger and your thumb out, with the third finger, the ring finger, pressed on your left nostril. Breathe in through your right nostril. Breathe in deep. Cover the right nostril. Drop the right nostril with your thumb and let go of your left nostril. Breathe out with your left nostril. Right nostril with your thumb. Let go of your left nostril and breathe out. Breathe in through the left nostril. Block it with your ring finger. Release your right nostril. Breathe out. Breathe in through your right nostril. Block in your right nostril with your thumb. Release your left nostril and breathe out. And continue for a count of 20. Result. And within 5 days, you will see a turnaround of your health. You're feeling more energetic, you're feeling lighter, your body is feeling lighter, your spine feels better. Now, because we can't do, I couldn't do 200 or 500 with you, as that takes up all the time, and Kapalbhati, which is the restricted releasing of breath. What we do here, we breathe in, puffing out your stomach, letting go of your abdominal muscles. Puff out your stomach, pull in a deep breath fully, then release it in short spasms, each time pulling in your stomach. Till you have no more breath within you. Pull it again, taking the oxygen, inhale deeply, stomach puffed out, and exhale in short spasms, 5 times maybe, or 6, as many as you want. With this, when you inhale sharply, when you inhale in short spasms, try and touch it as if trying to touch the navel to your spine. This is also very good to reduce your waist, to reduce your abdomen, and give you a much slimmer waist, besides all the goodness of your pranayama. So I will do it in Padmasana. This time, the right leg over the left leg, and the left over the right. This is here in my Jnana Mudra, the thumb and the index fingers pressed together, and breathe in, breathe out, breathe in, breathe out, breathe in, and breathe out, breathe in, breathe out, breathe in, and breathe out, breathe in, and breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, pulling in your stomach, breathe in, breathe out, 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 breathe in, breathe out. Last 3. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Okay. Now that you should be rejuvenated, stretch out your legs right in front, and we are going to do the Paschim Utthana Asana, which is basically touching your toes. For those of you who cannot touch your toes, you can come up to your knees or just barely touch the toes. Those of you who are more adventurous can wrap around your palm around your feet and rest your forehead on your knees. That stretches your entire body, really opens out the lung, the Anahata chakras, the cardiac system. It's good for your respiratory system, and also it is very good for your spine health. As you breathe in, hands up, fingers interlocked. As you breathe in, elongate your spine, go down, go down, go down. Here you've touched your feet. Now rest your forehead on your knees and count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9. And gently come up. One more repeat. Palm up, fingers interlocked. Stretch your arms as much as you can, elongate your body, elongate your spine. Breathe in and come down, elongate your spine. Put your forehead on the knees and count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9. And up we come. Next we are going to do the right and the left stretch, which really helps your lungs and your spine health, your respiratory and your cardiac system, helps in the blood circulation, so it's going to benefit your skin and hair if you can do it every day, and helps reduce your waist. So arms up. With one, I hold the fingers of my right leg, with the other behind my head, and I rest my head on the knees. 1, 2, 3, 4, 5, 6, 7, 8, 9, and come up. We repeat on the other side with the alternate hand. This is now we use the right hand to hold the left feet, and here goes. Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. We repeat once again for the second cycle. Here are my arms. I hold on to my toe of my right hand, holds on to the right leg toe, and the left hand goes from behind and tries to touch the heel. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. We repeat on the other leg. Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Come up now. We shall go into the Vajrasana posture, which is knee sit. Kneel down and sit on your knees and hold a namaste behind you. This stretches out the lungs. It's very good for your lungs. It stretches out your body, your cardiac muscles, and helps fortify your lungs. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now we stretch and touch the floor in Shishu Asana. Here we touch the floor. I hope you can see me as far as you can, and rest your forehead on the floor. Stretch up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Raise your arms up here, and we go on to the Namaskar again at your Vajrasana posture. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And we go back into Shishu Asana, which really relaxes your entire body and stretches your body. Here your arms hold on to the floor with your palm. Rest your arms on your mat and rest your forehead on the floor. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And up you go. Next, we are going, this was the Shishu Asana and the Vajrasana. We are now going to do the puppy posture. Here you are. Kneel stand. Stretch out your arms as much as you can. Here. And rest your forehead on the floor. 1, 2, 3, 4. You can also rest your chin, whatever works better for you. 5, 6, 7, 8, 9 and 10. Come up to the tabletop position here. Rest for 3 seconds and get back into the puppy posture. Here you go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And tabletop position. Now what I'm going to show you is very relevant for our current COVID times when people are looking for oxygen cylinders. There is one exercise that has been recommended by doctors looking after crisis like this that helps pump oxygen into your body. If somebody is not so serious and in such an emergency, but still needs oxygen because the oxygen is falling short, maybe the oxygen in the body is about 83 or 84, then there is a natural exercise with which you can fight back and pump oxygen into your lungs. You get into the puppy posture. Make your hands into fists like this. Breathe in and breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. So you know your breathe in and breathe out with bellow breath, but you have to get into the puppy posture for that. This has been recommended by emergency cells when somebody is fit but your oxygen is falling low. Instead of relying on the oxygen cylinder, which is an outside source, rely on your own body for strength and creating resistance. What you need to do is your bellow breath, deep breath in and deep breath out in the puppy posture. Next, we are going to do the dog, the downward dog. Here we are in our tabletop posture. Now we will get up. Here we are standing up, feet about a little apart, and here we go. And try and take your head between your elbows. 1, 2, 3, 4, 5, 6, 7, 8, and 9 and 10. Go back into the tabletop posture before we repeat this again. Why am I focusing on these 3 postures today? Because it really helps get in oxygen into your body when you are in an inverted posture like this. Again, get up, feet firmly on the floor, head, ears trying to touch the elbows, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Get back into the tabletop. We are next going into the Cobra, the Bhujangasana, which is also an asana that is recommended for patients who have suffered from tuberculosis and creates resistance against it. Place your palm on the mat at the same level as your shoulders. Here it is, in line with your shoulder, on your stomach, and raise yourself up to your navel. This is the Cobra posture or the Bhujangasana. Till your arms are straight. Count 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10, and go down. Rest your hands by the side for 3 seconds. Once again, bring your arms near your shoulder. Feet are together, touching each other. Raise yourself. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Lower yourself on your mat, hands by your side. Now we are going to do the Dhanurasana, the bow, which is again very good for your respiratory system and it fortifies your lungs. It helps fight depression, panic attacks, anxiety attacks, and keeps you positive. Fold in your legs. Hold your feet and raise your entire body as much as you can away from the floor in the bow, Dhanurasana. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Go back on the floor for 5 seconds. Because anything that you do for 10 seconds, you need a 5 seconds rest before you go on to the next asana. We shall repeat this once again. Lift up your legs. Hold on to your feet and raise your body. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. I think all of you would have done the Dhanurasana. Now I'm going to go on to the Tadasana, the mountain climbing position, which is to optimize oxygen that goes inside your body, and it is also a recommended asana for tuberculosis, to keep tuberculosis at bay, and if you already suffered, then to create stronger lungs. Here you raise your arms above your head straight, interlock your fingers, and you go up on your toes, heels above the ground, and breathe in deeply. 1, 2, 3, 4, 5, 6, 7, 8, 9, and come down. We repeat it twice more. Ready? Arms above your head, fingers interlocked. Take a deep breath and stand on your toes, heels above the floor. 1, 2, 3, 4, 5, 6, 7, 8, 9, and exhale, bringing down your arms. This was your Tadasana. We will now go into Trikonasana, which has always been prescribed to, it is known as the lung asana, and it also helps your kidneys and your liver. With the Trikonasana, your feet should be 3 feet apart. The right foot turned outside as if you're walking away. Then arms by your side straight. Left arm up straight at the ceiling, and rest your right hand on the floor. Look up straight at the ceiling at your hand for 1 full minute. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's half a minute. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Slowly come up. This is recommended for 1 minute straight and 2 cycles because it is known as a lung asana. We do the left side. See, feet 3 feet apart. The left feet now turned outside as if you would walk away this side. Hands straight. The right hand now should go pointing to the ceiling, and the left hand rests on the floor next to the left feet. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Last 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Gradually get up. This also puts your pelvic muscles in place, strengthens them, and looks after your spine. We'll do it once more, but you don't have to do it for 1 minute. That you can do by yourself. Again, 3 feet apart. Turn your right foot outside as if you're going to walk away. Hands on the side, straight, super straight. No drooping, no slouching. Breathe deeply in, and here we are at Trikonasana. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Here up we go, and the left feet. Turn the left feet outside as if you're going to walk away. Arms super straight at shoulder level, no slouching or pulling in like this. Relax, let your muscles go. Breathe in deeply. Right hand up towards the ceiling. Left hand next to left feet. Look up at your arm, look up at your raised arm at the ceiling. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Here we come. Next, I'm going to get on to our Surya Namaskar. The Surya Namaskar, as you know, is a complete body routine, it's a complete body regimen. And if you do it about 21 times a day, it's equal to the entire cardio workout that your body needs. You can do it at home, not stepping out into the gym or anywhere else, and it's a complete body and mind workout. Besides the 9 asanas that are put together, that benefits various parts of your body. So here we start with the pranam. The pranamasana, just for pranamasana also, make sure you're breathing deeply, your body is very straight, your arms are at shoulder level, and your back is super straight. Press the palms of the hand against each other. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Back bend now, take it back. After 10, we will touch the toes, or rather, I'll come over this side so you can see me better, all of me. From here, we'll go onto the floor and touch the floor ideally on the side like this or in the front, or you touch your toes or touch your knees as much as you can go down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then stretch out your body into the downwards dog posture like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We into the equestrian, the horse rider posture. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Go back to the downward dog like this. Repeat with the left. Here we come. The equestrian posture with the left leg. Count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now go back. Now we will do the Ashtanga Namaskar. Knee down. Then we will touch the floor with our chin and our chest. So there are 8 points of the body meeting the earth. Your feet 2, your knees 2, 4, and your hands 2, 6. 7th is your chin and 8th is your chest. Your stomach and hips are raised away from the floor till you get into Bhujangasana. So we do the Ashtanga Namaskar. Here are my hands. This is the Ashtanga Namaskar. And we go into the Cobra posture or the Bhujangasana. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Downward dog again from here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Followed by the floor touch. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We come up. The backwards bending, backwards stretch. And to the Pranamasana. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'll show it to you once again. First, this is the Surya Pranam, Surya Namaskar. Ideally to be done in the morning. If you can't, if you have to do it in the evening, make sure you do it when there's still sunlight around. Here we are. The Pranamasana. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The backwards bend. Then we come up and touch the floor or touch our toes, whatever you can. The downward dog. The equestrian posture, the horse riding posture. Right leg followed by the left leg. Back to the downward dog. And we do the Ashtanga Namaskar, which is touching the floor with your feet, as you can see. 2 feet and 2 knees, that is 4. 2 hands, that is 8, 6. And we are going to touch the floor with our chin and our chest without letting the stomach and the hips touch the floor. That is the Ashtanga Namaskar. Here we go. Then morph into Bhujangasana or the Cobra, which is one of the top asanas for lung health and helps the respiratory system get more resistance. Back to the downward dog. Stretch out your bodies. Come towards your hands. Touch the floor again as much as you can. Go down. Come up. backward bend, and the Pranamasana. I think that would be all for the Surya Namaskar today. Now we shall do some of the mudra, the mudras, the mudra yoga that really helps our bodies. As you know, the 5 fingers in our hands symbolize a different part of the body and a different quality of energy of the body. And by the mudras, when we do the mudras, I'll come closer so you can see my mudras better and do it yourselves. The mudras, what happens is different parts of the fingers touch another part of the other finger, and this kind of channelizes energy to specific parts of the body, opens up specific channels of the body. You know, the active and the passive channel of the body has to be rightly activated so that we have a balanced way, a balanced feeling, you know, so the body balances our energy as well. So first I will start with Bhairav Mudra. Your right hand is over the left hand, like this. Right like this. The right hand over the left hand. This is the Bhairav Mudra, the Shiva Mudra, which is supposed to energize an entire body, give you more energy, give you more enthusiasm and feel dynamic. This is the Bhairava Mudra. Now, we will do the Bhairavi Mudra, the Durga Mudra. The left hand over the right hand pressed tightly. You can see my arms are at shoulder level, it's not slouching, it's not like this. Straight like this, spine straight, sit straight. The left hand over the right hand. The Bhairavi Mudra, which calms down the senses. So the Bhairava, Shiva Mudra, helps to activate, and the Bhairavi Mudra will calm you down. Next we'll do the Ganesha Mudra. Here we go, clasp it on and hold it. This really helps the respiratory system, high blood pressure, cholesterol and thyroid issues, and helps your lungs, helps you from getting asthma attacks, you know, or bronchial stress. This is the Ganesha Mudra, the right hand clasping over the left hand like this. The Brahma Mudra, make your hands into fists with the thumbs wrapped around, and here it goes. This is the Brahma Mudra. Again, make your hands into a fist, wrapping up your thumb last, and hold it like this. This is the Brahma Mudra. The Brahma Mudra helps hypertension, helps panic attacks, anxiety attacks, and really helps good liver function. This is the Brahma Mudra. So Shiva and Brahma covered, we are left with Vishnu. Vishnu, as you know, has the Shankh. Here is your left hand. With your right hand, hold the left thumb. Fold it in so that the right thumb will touch the left ring finger like this. Hold it and turn it and press it. This is the Shankha Mudra. This also helps hypertension, nervous attacks, and this really helps panic attacks and helps your bronchial system. This is the Shankha. I'll show you again. See, this is my left hand, this is my left thumb. With the right hand, I hold my left thumb, fold it in so the right thumb touches the left ring finger and hold it here. This is the Shankha. You can do each for about 10 or 15 seconds and a round of 5. And in 5 or 7 days, you'll see the difference. This is the Shankha Mudra. This is the Sudarshan Chakra, the chakra. Here, this is my right hand. With my left hand, the thumb presses on to the index finger. This is the chakra. This again helps your liver. This helps your respiratory system. This helps your trachea. And this helps blood sugar. It's a very good remedy, or I would rather say that it helps regulate your blood sugar. So this is the Shankha and this is the Chakra. Next, we have something which is called the lung mudra or the asthma mudra. Here are your hands. Fold the middle finger and join like this. And the rest of the hand fingers are joined. Here you are. See, all the fingers are out. The middle finger, join it out like this and touch the hand. This is known as the asthma mudra. The middle finger is folded and joined. All the other fingers are touching each other. This is the asthma mudra. Next, we'll go on to the bronchial mudra, which is also another lung mudra. And here, we will touch the middle finger to the thumb, like this. Fold the ring finger and the little finger, and your index fingers are out, and here we are. This is the bronchial mudra. Here the pressure points are being pressed in such a way that it helps blood circulation and it really helps de-stress your system, because as you know, stress, panic and anxiety brings about asthma attacks, brings about breathing distress. So this really helps in removing that stress and helping you from getting asthma attacks and helps you breathe better. Here we go. We'll just go over the mudras once again, because these are the easiest things you can do. Whatever may be your condition of your flexibility, you can sit on a bed or or a chair or an armchair, or while watching TV or while watching news, you can do the mudras. And as I would suggest, please do include everybody in the family. You might have an older grandmother or a grandfather or both, and it would be wonderful for them to do it with you. That participation, that inclusivity will help the family function better in these times of darkness. And also it would really help getting their health better, getting their breathing better. So here is the Bhairava Mudra, right hand over the left hand pressed. Remember to keep your shoulders high. At the arms should be at shoulder level, not up, not down. Here they are. Spine super straight, pull in your stomach, breathe right. Bhairava Mudra, right hand over left hand. Bhairavi Mudra, left hand over right hand. Ganesha Mudra, right hand and left hand clasping each other. Brahma Mudra, fists curled up, thumbs wrapped over and holding it like this tightly. That is the Brahma Mudra. Next we go on to the Vishnu Mudras, which is the Shankh. Left hand and right hand holds the thumb and folds it in, so the thumb presses the ring finger. This is the Shankh. This is the Chakra. Here we are, the thumb and the index finger pressing against each other. Then we have the Asthma Mudra, folding in the middle finger, touching each other like this, and the rest of the fingers touching. And we have the Bronchial Mudra, where we touch the middle finger to the thumb, fold in the ring finger and the little finger, and your index finger is out like this, which really helps in fortifying your lungs and helping you from asthma attacks or breathing distress. And last but not the least is your Anjali Mudra, your palm pressed against each other. The Pranamasana or the Namaskar that we Indians are known for. It's our signature of greeting each other, of respecting, saluting oneself and another. Here we are with our Namaskar, with our Anjali, and that would be the end of the session today. I would like to tell all of you that these dark times when the COVID is so rampant, let us try and make good health and positivity as infectious as or more infectious than the disease, so we can hit back and India can be strong forever and hit back and fight back and stay in our health and happiness. Namaskar.
A very warm welcome, everyone, to Panacea. I welcome today Dr. Anshu Sen, who is a consultant neurologist from Kolkata. I welcome you, sir, for your session. And he will be speaking on COVID-19 neurocare during COVID-19. Sir, I leave the dais to you. I leave the virtual dais to you for your session. I'll come back with a few questionnaire.
Thank you. I'm Dr. Angshu Sen, Senior Consultant Neurologist of Ramakrishna Mission Seva Pratishthan and Colombo Asia Hospitals. The most common and important presentation of COVID-19 is usually the respiratory diseases, but the reports of neurological features are increasing day by day. This may be a manifestation of combination of non-specific complications of systemic disease, effects of viral infection, and inflammation of the nervous system, which can be infectious, para-infectious, or post-infectious. The non-specific complications of the severe disease emphasize that it is not only limited to the central nervous system, it also affects the peripheral nervous system as well. So both the central nervous system manifestations and peripheral nervous system manifestations of the disease have been reported. The common manifestations and the presentations of COVID-19 with neurological symptoms include encephalitis, encephalopathy, stroke, epilepsy, ADEM, which means acute disseminated encephalomyelitis, stroke, particularly ischemic stroke, and central venous sinus thrombosis, acute inflammatory demyelinating polyradiculopathy, also known as GB syndrome, myelitis, which means infectious or demyelination of the spinal cord, and muscle breakdown, which manifests as rhabdomyolysis. Thing is that the symptoms of the patients in COVID-19 who present with neurological problems do not differ significantly from those who do not have COVID infection. But thing is that how to identify those patients who are harboring the disease and how to treat them properly with safety measures. Acute stroke is encountered in patients who have vascular events in the context of pro-inflammatory hypercoagulable state, and certain blood parameters are elevated in these conditions. For example, there is increase in blood levels of C-reactive protein, D-dimer, and ferritin. Next, we come to another emergency problems encountered in neurological practice, which is epilepsy. We frequently find that patients have attacks of repeated seizures despite on anticonvulsant medications. And the most common problem is that they frequently cannot remember that whether they have taken the anticonvulsant medications. Sometimes they take it in overdose, sometimes they forget to take the medications. So we must ensure that all patients of epilepsy must have adequate supply of anti-seizure medications, and they must contact their pharmacy first to see whether they can get at least 1 month supply of medicines, if not more. Because in this pandemic situation, if there is a precipitation of status epilepticus or violent epilepsy or convulsion, it will be difficult for the patient, either because of fear of coming to the hospital or reluctance to come to the hospital because of contracting the disease. So we must ensure that all patients of epilepsy, not only epilepsy, those patients who have hypertension, who have diabetes, who have other comorbidities, must have adequate supply of medicines at their home. Very important. This is a very stressful time, and we must stay connected with each other. Very, very important. We should not neglect that the medicines should be taken at a proper time in a proper dose. Sometimes there are situations when, despite taking the medications in the proper dose and not missing the medications, epileptic attacks can happen and they necessitate hospitalization. There are some certain situations where we need to go to the emergency if a person with epilepsy have seizures with loss of consciousness for more than 5 minutes, and there is no rescue medicines which is able to be taken at home. We commonly prescribe midazolam nasal spray, which can be taken at home. If it does not work, and if there is a repeated convulsion despite the rescue medications, or we can also give injection lorazepam, which can be given by local physician if she or she is available. Then she must come to the emergency. Second situation which necessitated hospitalization, when the seizures continue despite a person has taken a rescue medicines. Seizures emergency that can be treated safely at home, which cannot be treated safely at home. For example, a person who has sustained a head injury, or the person who has aspirated, or the patient has got breathing problem. These are the situations where, despite taking the medicines, the seizures happen and they necessitate urgent hospitalization. There is another entity called sudden unexpected death in epilepsy. This has been correlated with COVID-19 infection. It has been found that persons who have COVID-19 and who have epilepsy, the chances of this incident is high. That is also known as SUDEP, sudden unexpected death in epilepsy. Are the patients of epilepsy more susceptible to corona? Is a common question. Or a person with stroke susceptible to corona? Or any person with dementia or patient with multiple sclerosis, are they susceptible to the virus? More susceptible to the virus. In patients who have got epileptic attacks, there are certain patients who have autoimmune epilepsy, or being treated with either steroid or immunotherapies. They may lower the immune status of the patient and may make them vulnerable to COVID-19. This is a possibility, not definitely proved. These are all possibilities. Certain anti-epileptic medications can give rise to severe skin rashes. For example, the newer anti-epileptic medications like lamotrigine. So before prescribing the anti-epileptic medications, we must warn the patient that if or she develops any skin rash or any anaphylactic reaction, he must contact the doctor or must come to the nearest hospital. If it is not possible to come to the hospital, teleconsultation is available. They can contact the treating doctor and must stop the medicines immediately. There are also certain adverse effects of other anti-epileptic medications. For example, levetiracetam, which can precipitate psychosis or some mood disorders, even suicidal attempts. So before prescribing the medicines, the patients must be adequately explained regarding the side effects of all medicines. Because in this pandemic situation, it is not possible for the patients to come to the hospital, and if they develop the side effects, they become restless and anxious and they search for the immediate relief. So they should be convinced that even if the side effects occur, they should not be panicky and should not be at a loss. They should contact the doctor and take actions adequately and accordingly. We frequently encounter problems in patients with Parkinson's disease and patients with dementia, particularly Alzheimer's disease, in this pandemic. They frequently face problems, especially they feel isolated when they do not find the healthcare facilities running properly. So the healthcare workers should also take proper precautionary measures to safeguard themselves. At the same time, they should help the persons with dementia to carry out the activities of daily living in a proper way. In this pandemic situation, all of us are going through a severe crisis. This is telling upon our physical health and mental health. We must stay interconnected, especially patients who have dementia, particularly Alzheimer's disease. They have behavioral problems, they have emotional problems, they have psychosis, they have psychoneurosis. They should be handled with tender care. They frequently feel very isolated and become restless. The healthcare workers must be trained accordingly because they also feel very panicky for the fear of contracting COVID infection. They must take proper safety measures to protect themselves and also the patient. There are increased financial stress and time demand and worry of getting COVID infection. Caregivers try to ensure regular telephonic communication to help to reduce the social isolation. Very important. the person must not feel lonely. This precipitate acute behavioral problems in patients with dementia, in patients with epilepsy, in patients with stroke. Many caregivers are trying to use virtual technologies to stay connected with their recipients. I must emphasize on patients who present to the emergency with stroke. Stroke means brain attack, which may be ischemic and which may be hemorrhagic. COVID-19 usually gives rise to ischemic stroke. Hemorrhagic strokes are usually not that common as compared to ischemic stroke in patients who have COVID-associated stroke. And many patients who have ischemic stroke are afraid of coming to the hospital within the golden hour, which is 4.5 hours to 6 hours. In that condition, we can give thrombolytic therapy, but as they're reluctant to come to the hospital, they must be convinced that the chances of recovery after thrombolysis, particularly the paralysis or hemiparesis, are much more if you do not do thrombolysis. So, thrombolytic therapy should be convinced in patients who have acute stroke, ischemic stroke, and the golden hour is 4.5 to 6 hours. We must take adequate precautionary measures, use masks, sanitizers, face shield. If intravenous thrombolysis fails, then mechanical thrombectomy may be needed. In that condition also, we must take adequate precautionary measures to safeguard ourselves and the patient. This is a very gloomy situation. The entire world is passing through this very critical condition. This is not telling only upon our physical, economical health, but also our mental health. And for that reason, apart from medicines, there is part of role of music, which I must emphasize, to elevate our mood and rejuvenate ourselves, and not only ourselves, and also the patients who suffer from mental agony. It has been found that music therapy, to a great extent, can alleviate the problems encountered in certain neurological disorders. For example, stroke, autism, epilepsy, traumatic brain injury, dementia, Alzheimer's disease, acute psychosis, depression, and I must emphasize the role of classical music and instrumental music, which help to improve the brain plasticity. And it has been found that patients who suffer paralysis after stroke get their power improved if they join a musical course, particularly instrumental music. The auditory motor circuit gets stimulated and there is gradual improvement in the power of the paralytic limb. Also, the patients with autism, hyperactive attention deficit disorder, shows quite a significant improvement if they are engaged in certain creativities like music, drama, drawing. So apart from medicines, apart from clinical examination and advice, counseling is also important in this pandemic period because we may take medicines. The medicines can cure, but at the same time, you also must remember the side effects of the medicine. Any patient who is taking anti-epileptic medications face the side effects of the medicines. They may feel isolated, they may feel restless. There may be behavioral problems in patients with epilepsy, dementia, Alzheimer's disease, stroke. They suffer from a lot of mental trauma, mental agony. We can prescribe antipsychotic medications, antidepressant medications, but they all may have some side effects. So, apart from the medicines, we must counsel them properly. Role of psychiatrist and psychologist cannot be emphasized. Certain things we must keep in mind that only the essential investigations which are required and only the utmost things which are actually needed in this critical period should be done. For example, in a patient who has got epilepsy, unless an urgent EEG is essential, it should not be done immediately. For example, in a patient who have got absence seizures, EEG is very diagnostic, particularly with a procedure called hyperventilation. But suppose a patient has come to us with suspected coronavirus infection. If we ask the patient to hyperventilate, there is a chance of spread of the virus. So, depending upon the clinical parameters, clinical signs and symptoms, we should treat the patient. And only the relevant, utmost relevant investigations should be performed. Regarding the rehabilitation and physiotherapy, incentive spirometry has an important role in patients who have got chest disorder, chest infection, or any pneumonia. They should do the incentive spirometry with proper precautions and with proper sanitization. Patients may have pneumonia which may need postural drainage, and chest physiotherapy has a very important role to play. The physiotherapist must be very cautious to protect themselves, and the patients must be protected by wearing masks, face shield, and so on, proper sanitization. The essential surgeries should be performed only. Certain surgeries can be postponed, but certain surgeries require urgent treatment. Certain surgeries should be performed on an emergency basis. For example, in a patient who have got stroke in the cerebellar hemisphere or in the posterior fossa bleed, who have a chance of brain herniation, must undergo surgery at the earliest, and then depends upon the decision of the treating neurologist and the neurosurgeon. Certain drugs which need to be administered when a patient have acute stroke to lower the intracranial pressure. For example, mannitol, diuretics, they need constant supervision and need hospitalization. The warning signs of stroke must be communicated to the patient or the patient's relatives. The high risk groups, those with comorbidities, for example, diabetes, hypertension, valvular heart disease, ischemic heart disease, irregular heartbeat, for example, atrial fibrillation, they must be warned about the signals of stroke. Another thing which I have frequently encountered in this pandemic is neurocardiogenic syncope. Many patients who present with transient loss of consciousness with impending fall, either presyncope or syncope, have been frequently found to harbor coronavirus infection. Actually, there is no specific sign or symptom of the disease. There are various manifestations of the disease. Actually, it can affect any system. So we must be vigilant. Patient may have gastritis, patient may have nausea or vomiting, may have myalgia or body ache, may have headache, which may be mistaken as migraine headache or tension type of headache. The patient may have taste disturbance, lack of smell, difficulty in vision. These symptoms should not be ignored. And if any of the symptoms are present or constellation of any of the symptoms are present, he or she must contact the nearest doctor. Certain challenges I've faced in this pandemic is emergency conditions which have occurred in a patient who are relatively stable. I have encountered two patients with crisis in known patients of myasthenia gravis. These are called myasthenic crisis, which necessitate urgent hospitalization. One of my patients received intravenous immunoglobulin for 5 days, after which he gradually improved. Again, he deteriorated because he had fever and was found to have coronavirus infection. Ultimately, he succumbed. Another patient had Guillain-Barré syndrome, who had problem with breathing. He recovered after plasmapheresis. Another patient of myasthenia gravis suddenly developed memory problem and acute confusional state. He had acute ischemic temporal lobe stroke. She was hospitalized, properly investigated, recovered after treatment in the hospital. Many challenges are there to treat the patients with neurological disorders in this current pandemic. The clinician must be vigilant to pick up the salient features which may be certainly uncommon with the characteristic feature of the original disease. We have frequently encountered patients of young stroke. 4 of my patients had ischemic stroke. One of them had lateral medullary syndrome, which manifested as difficulty in swallowing, imbalance during walking, and slurring of speech. There are no risk factors of stroke, no family history, no comorbidities. Another patient had middle cerebral artery ischemic stroke. He also did not have any comorbidities, no family history of stroke or cardiovascular disorders. So there are many manifestations of COVID which may be challenging to face in this pandemic situation. But we must stay interconnected so that the patients feel comfortable and at the same time they get proper treatment.
Sir, thank you so much for this wonderful session. And it was really interesting to know about the symptoms of neurological disorders which is happening in during COVID-19. Sir, one question, just one question, if you can answer about the some advice to the patients for the future preparations of the pandemic, and also, and if you can also tell us about the treatment scenario in India about the because it's ongoing digital age now, and what is the future of the healthcare in our country?
I'll emphasize that all patients must consult their doctors, whether they can come to the hospital directly or over teleconsultation. They must stay connected to the treating doctor. It is not always possible to examine clinically, and so many problems they may face during the pandemic. They may feel distressed, they may feel unsafe to come to the hospital. So I will advise that if they face any problem, they can call the doctor. They must take adequate precautionary measures to prevent the spread of the disease and to catch up the infection. Very important thing is that you must protect yourself and other people. If you protect others, you will be protected. And if you protect yourself, you will protect others. This is very important. And you must be develop self-awareness. Unless we maintain the health hygiene properly, no one can help us because we have to fight for ourselves. No one can fight for us. We have to fight for ourselves. For that reason, every person must protect himself so that he can protect others. This awareness must be created Because unless we create this awareness, only by giving uh, um, seminars and lectures will not do anything, because unless it is instilled into their mind, so this will perpetuate. So everyone should wear masks, N95 masks, especially those persons who are coming in contact with the any suspected patients, or any when they go out in the public closed spaces, they must use face shield. Proper sanitizers must be used, and there must be a social distance, and at the same time we must try to avoid close gatherings, and at the same time we must know that disease itself is taking various forms, and it is a mutation of the virus which is actually responsible for changing from one form to another. The disease manifestations are actually varying because of the mutations of the virus. Initially, it was found that the children are exempted. Now it is found that no age is not a bar. All population can all get affected. So it must be emphasized properly that even if we go outside, the we must take the precautionary measures. We must try to avoid air condition as far as possible, because it has been
Absolutely,
found.
sir. Yes, sir,
It's
I
very
absolutely
important.
agree. Yes, it is very, very important. And with this, we have to conclude our session with you today. And thank you so much for your time. And definitely, we'll be getting back with the same questionnaire with you, and we'll be forming a sort of interview where we can post it on our website, which is panacea.iletsonline.com. And I would also like to thank Ilets eHealth, Narayana Health, and along with that, Viatris Mylan Company. So thank you so much, sir, for your time, and we'll again get back to you for future sessions with you.
Welcome. Thank EL itself also once again.
So if there are 100 cases in all over the world, 26 cases are from India. So such a high burden country we are having. And if you'll ask me, Mumbai and Peri-Mumbai area, that is Mumbai and Thane Municipal Corporation, have the maximum highest number of tuberculosis patients. In 2019, we almost had 79,144 deaths due to tuberculosis. All over the world, it is the around 1.8 million people have died because of tuberculosis.
अगर कोई आदमी अपने लाइफ में इस बात को उतार ले, उसका पालन करने लगे कि वो रोज सुबह उठे 4 बजे, 4:30 बजे, 5 बजे भोर में, और उसके बाद वो 10, 15, 20 मिनट, आधा घंटा टहल के वो योगा कर ले, अच्छा योगा का एक पैकेज अगर वो कर ले, वो कभी जिंदगी में बीमार नहीं हो सकता. यही प्रिवेंशन है.
Next, we will go on to the bronchial mudra, which is direct relations with your bronchial system, your respiratory system. Here is your hand. The middle finger is pressed.
A very warm welcome, everyone, at Panacea. Today we have with us Dr. A. Rahman Chisti, SMO, State Government of Manipur. So I welcome you, sir, to Panacea today. He will be presenting a PowerPoint presentation on tuberculosis awareness initiative, which will be extremely beneficial for the entire country right now, which we are fighting about COVID-19 and tuberculosis treatment as well. So, sir, I'll leave the virtual dais to you, and you can begin presenting your PPT. Sir, I'll come back with a few questionnaires.
Yeah, TB awareness initiative. I'm presenting on TB awareness initiative. Next, yeah. TB remains one of the biggest public health challenge with an estimated 27 lakh new cases occurring annually. India accounts for 27% of the global burden of TB and has the highest number of new TB cases every year. India also accounts for 32% of the mortality due to TB globally, accounts for 24% of the total MDR TB patients. Next, my work in TB. India target TB elimination in the country by 2025 through its ambitious National Strategic Plan 2017-2025, 5 years ahead of the global targets of 2030. My vision is TB-free Manipur with zero death, disease and poverty due to tuberculosis. My goal is to eliminate tuberculosis from Manipur before 2025. The National Strategic Plan for TB elimination in India based on focus to reduce estimated TB incidence rate per lakh population, to reduce estimated TB prevalence rate per lakh population, to reduce estimated mortality due to TB, that is also per lakh population, to achieve zero death, disease and poverty for affected families due to tuberculosis. For Manipur TB notification trend 2020, our figure is very low because of the COVID problems and others, so the program could not function. The total notification target is 3,500 for Manipur. And in public sector, we achieved, target was 2,500. We achieved 1,127, percentage 44.4%. Private sector, the target is 1,000. We achieved 426, that is 42.6%. So out of 3,500, we achieved 1,553, that is 44.4%. Next. Status of DVD in PY Manipur. Amount payable 35.1 lakhs. But Manipur government, due to COVID program and others, and bank has been freeze, so we could pay only 10.2 lakhs, that is 29%. The NTB initiatives in Manipur. We have started TB Jan Andolan 2021, launched on World TB Day 24 March 2021 in Manipur. People's movement as envisaged by Honorable Union Health Minister, making 2021 year of TB across India to maximize efforts to reach the unreached, to reverse losses due to COVID-19 pandemic, launch of Gatiman project to intensify NTB activities in 50 districts of Manipur. Ukhrul district selected in Manipur for the project to continue till 2025. Next, state government and TB HIV testing policy Government policy is to counsel and test all notified TB patients for HIV. All people living with HIV are to be initiated on ART and CPT. All people living with HIV are also eligible for TB preventive therapy. Next, regarding the supply chain management, NTEP drugs are supplied from CTD, that is Central TB Division, Government of India, to the state drugstores, from where drugs are forwarded to the district drugstore. From district drugstores, they are then supplied to the TB units and further down to the PSIs and treatment support centers. Nixie Osadi software is used for drug supply chain management under NTEP. Policy intervention in the state. All policy interventions laid down by Central TB Division, Government of India, is implemented by the state with state-specific modification wherever required. Interventions to prevent spread of TB. Decentralized treatment for all TB patients near their residence through treatment supporters so that they don't need to travel for treatment. This indirectly prevents the spread of disease in the community. SCSM activities include awareness generation among the population to take measures to prevent spread of TB, such as covering mouth while sneezing or coughing, ensuring compliance to treatment for early recovery to cut the chain of transmission. IC activities among the general population regarding the early signs and symptoms of TB for presenting themselves to the nearest health facilities for early diagnosis and treatment. TB preventive therapy among the contacts below 5 years who are contacts of active TB disease and among people living with HIV to prevent them from active TB disease. Next. How important is infrastructure for monitoring TB? Yeah, it's very important because importance of infrastructure related to diagnosis, treatment, and monitoring. Lack of infrastructure related to treatment will compromise the treatment of TB patients and will lead to death, default, and failure of treatment. Lack of efforts to establish infrastructure for the district TB center, TB units, DMCs, that is designated microscopic centers, and treatment support centers as per NTEP guidelines. Establish CVNet and TrueNet centers in all districts. State government has taken all effort to ensure Nixie Posan Yojana as per NTEP guideline to provide rupees 500 per month to TB patients in their bank account, direct benefit transfer as nutritional support. Provision of tablets to all NTEP field staffs for real-time data entry in Nixie for effective monitoring and supervision. Involvement of both we have two medical colleges in Manipur, and that is involvement of both the medical colleges, RIMS and JNIMS, for service delivery, and they are also part of state task force of NTEP. Involvement of TB champions. TB champions means those patients who had been treated for TB and they are cured. We are using them in the state and district TB forums. Active TB case finding activities conducted in all the districts among the vulnerable population for early diagnosis of the active TB cases. Involvement of various NGOs for NTEP service delivery as per NTEP guidelines. Thank you.
Last year, when the pandemic started, for although it is ongoing, the second surge. If you can kindly elaborate on that a bit.
Because during the COVID pandemic, we had very difficulty in conducting the program because the higher authorities are utilizing my manpower. They are posted in the quarantine centers, treatment centers. They have to collect the specimens for COVID testing, and they are utilized for mainly COVID testing. And the technician and others who are very important for conducting the sputum test to detect TB, they are posted in the COVID centers. They have to collect the specimen, transport it to testing centers. That way they are being utilized. And even machine which is supposed to do the TB testing for COVID testing. And that way we have been focusing on that. We could not utilize the fund because there was shortage of fund was diverted, and for fund main priority was on COVID activities and COVID cases. So we released fund. My SMD, State Mission Director, he was very kind. I convinced him that we have to release fund to the districts, otherwise our activities are. But even if some meager workers which we have, we try to send them to the different districts and villages. But what happened is because of the COVID pandemic, they become scared. So they don't want any other people to enter the village. So they always side screen, and any person who have to enter the villages or districts, they have to be screened, and also people become more negative. So those difficulties we faced during the. But in spite of that, we carry on as if we treated TB patients. That's why my figure, which I have shown, it's a bit down because of those challenges we faced, madam.
Absolutely, sir. It has been a really great challenge for us also everywhere. Since last year, we've been fighting COVID 19, and along with that, the rising cases of tuberculosis as well. So,
Yeah.
if you can tell us about a bit about the digital healthcare system, which is right now, which has India has adopted. And what is the future of the treatment through digital healthcare system, like telemedicines and all, in regards in treating diseases like tuberculosis and all?
Question is, madam, the country is much ahead with the treatment part, but madam, one thing which we are in the northeast, we belong to we are bordering Myanmar. Manipur is bordering Myanmar, madam. So I had attended many conferences in the cities. There is always some differences happening in the major metropolitan cities and happening in this part of the country where we have lots of difficulties. But still, we are trying to put up with the advancement which the country is having. We are trying our level based method. We are also proposing, we have to propose through the PIP because, madam, those facilities are there. But the thing is, we need more funding is important. We have difficulty in fund, and also we have to propose in the PIP action plan. Then only we can implement it. Even if we implement it, we want to do it, but madam, we have to bring it out to the government, and government higher authorities. Sometimes they will say that these sophisticated things, we will go for this, we will go for that. Those things are also there, madam. So we have to present, and we have to convince the higher authorities, show them the benefit, and that's how we are trying to implement well.
Absolutely. So, sir, I would like to thank you for this wonderful session of yours regarding TB awareness initiative. Sir, if you can say a few parting words about the treatment and how people can be alert about this deadly disease along with COVID-19. Sir, your parting note on the entire session of Panacea today about TB initiative.
You know, question is TB symptoms and COVID symptoms are similar because both have fever, the presentation part, and also the presenting symptoms are cough, difficulty in breathing. That is also there in TB cases. So what we do is, what we give message to the people is that, because treatment is free, we give free treatment, so they have to come out, and TB treatment is free of cost. All the public sectors, public institutions and private sectors are all there. They have to go, present themselves when they have all the symptoms, and then take the benefit. And that way we have included all. So, madam, my parting speech is this: we have to support the government programs, whatever are there. These are all for the benefit of the people. So they should come out with their symptoms and then get screened, and then take the facility of getting the treatment also, madam. Yeah, thank you, madam.
Thank you so much, sir, for taking out time from your very busy schedule and joining us today for this interview on TB awareness.
My pleasure, madam. My
Thank
pleasure.
you so much, sir. Thank you so much. I will get in touch with you for further articles as well. Sir, once you get free, I'll definitely get in touch with you regarding further articles on it. Thank
You
you
are
so much.
always welcome. You are
Thank you
always
so much.
welcome. My pleasure. Thank you. Thank you.